And I do want, we normally give a short COVID update. In lieu of that, I will tell you our numbers continue to improve. We've sort of plateaued a little bit. They're a little bit higher than they were back in November, but they're still trending downwards. And we do have some gentlemen here. I'm going to ask our Deputy Director of VMA, Chance Corbett, to come forward with his guests. And I want to apologize to these gentlemen. Truthfully, as significant a challenge as COVID-19 is, and trying to get vaccinations in almost 200,000 people around Columbus, the most pressing issue in our community right now, I think, has to be the violent crime. So please forgive me for moving that up on the agenda and dealing with that first. So we are glad you guys are here. Chance?
Thank you, Mayor. It's a privilege to be here today. As you know, from communication we've had recently, we've had some very good news in the Columbus area. For one, we've had clinics that have been very successful at the Civic Center. That coupled with several clinics we've done with DPH, and we continue to do those. We scheduled 6 more yesterday for smaller areas out in the community, and per a lot of the direction from the mayor, trying to get it out into areas like some of the schools and recreation areas. Today, I'm privileged to have, obviously, I have Chief Scarpa here with me from the Columbus Fire and EMS, but also have 3 members from GEMA. They are already on site at the Civic Center. They're already setting up, and they will be on site until the clinics are finished about 13 weeks or so from today. We're excited to have this type of organization, this type of event coming to Columbus. I think there are a lot of cities and counties across this state that would love to have this opportunity. We have heard the messages from people that have signed on to DPH trying to get an appointment, have not been able to. We've heard great feedback from those that have. We feel that with having GEMA in town and running these clinics at the Civic Center, it's going to be great. We met with them on site last Thursday. They brought in 2 helicopters full of team members to meet on site to look at the layout. They're going to use a layout very similar to what we used in the previous clinics because it worked. We had very good feedback, and they felt that it was going to work as well. We feel this clinic will be likely be one of the larger clinics in the state of Georgia, and we're just excited. So I'm going to ask, Jason is the regional coordinator from GEMA. He is our regional coordinator in this area, but he'll be the site manager as well, and I'll let him introduce the other 2 people he has with him. Jason?
Good morning, Mayor, Council. Thank you so much for having us here. We're excited to be in Columbus. I have spent the last 6 years as the Area 4 Field Coordinator for the Georgia Emergency Management Agency. Live in LaGrange, so not too far away. Frequent Columbus a lot with my family. But Mayor, thank you, and Council, thank you for having us here in Columbus and hosting us. We are your guests until midsummer, and are happy to be here. Chief Scarpa, thank you so much. Chance Corbett, for all of your support that you've given us, and to my new best friend in Columbus, Rob Landers at the Civic Center. Rob and Brian and his team have been outstanding to us already, and we've only been here a few days, and so thankful to be hosting a site here in Columbus. I've spent the last month or so over in Macon, Georgia, doing the same thing, and we've been very successful. Last Thursday, we administered our 10,000th vaccine there in Macon, and it was an honor to be there to do that. We are not doing this alone. GEMA is a coordinating agency. We work under the Office of the Governor, and we have some special folks that are helping us. The Georgia DOD, the Army National Guard, and specifically will be here on site with us in Columbus. There'll be about 45 members of the Army National Guard. FEMA will have a slew of people here helping us with registration, and then our private contracting nurses who are here that will be helping in association with other state agencies, the Georgia Department of Transportation, Georgia Forestry Commission, believe it or not, and so many others who are stepping up to help us. The Columbus MVS, I use the acronym MVS, Mass Vaccination Site, is one of 9 in Georgia authorized by the governor. We started off with 4 and ran those for a few weeks, and now we're starting off with 5 more to place these mass vaccination sites strategically in the state of Georgia so that we can get the most shots and the most arms possible. Just a little bit of information. You have a FAQ sheet in front of you, Council. My deputy site director, Edwin Whitworth, will go over that here in just a few minutes. But just to give you an idea, try to answer some questions off the bat for you. We will start putting shots in arms on the 17th of March, next Wednesday. And we will start off at about 1,100 a day, 5 days a week, Monday through Friday. We will do 1,100 vaccines, or we will make available 1,100 vaccines a day. We will do that for about 3 weeks, and then we're going to bump up to 2,000 a day. We'll do that for a while and see how that goes, and if Chance and Chief Scarpa have their way, we'll bump up to 3,000. And I'm perfectly okay with that, but definitely in the plan is for us to start off at 1,100 or so a day, and then strategically move to around 2,000 a day. We are using the Pfizer vaccine solely. We're not using any other vaccine, just Pfizer for now, and we have ultra-cold storage on site, a highly technical refrigeration system that will hold this vaccine at negative 60 degrees Celsius on site in the parking lot of the Columbus Civic Center. Anyone who wants to register, and Edwin again will talk about this, but I'll throw this website out to you, myvaccinegeorgia.com. myvaccinegeorgia.com would be where you would go to register. And let me say this, that anyone can register. Anyone can register on this site. However, you will not be afforded an appointment unless you fall into the category, the phase that the governor has listed out right now, which is phase 1A plus. It includes healthcare workers. It includes long-term care facility patients and staff. It includes Georgians over 65 years old. Also includes public safety personnel as well. And today or yesterday, we actually extended that phase to include pre-K through 12th grade educators and staff of educational facilities, adults with intellectual and developmental disabilities and their caregivers, and also parents of children with complex medical conditions are also qualified now. Going forward, as seem fit and as we are getting shots in arms of people who qualify now, those phases will be extended. And so we look forward to doing that. I'm going to have Edwin come up and go over the FAQ that you have in front of you, and Edwin will give you some information on how we're going to get this word out to folks and how the operation will go, and then we'll be available for any questions.
Good morning. I'd like to say thank you again for allowing us to come in and speak to you this morning. If you look in front of you, there's FAQ, as Jason said, myvaccinegeorgia.com. Messaging is going to be key, and so we want to make sure that we have the same message as we move forward. I know we'll be working with the Civic Center, Rob Landers and his team, to try to do as much as we can to publicize this message, and I know we'll be working with you and your staff as well as we move forward in the next by the end of the week with our public relations. What I want to talk about today is a FM radio station. We're setting up at the Civic Center. In fact, Rob Landers and his team has actually already got a transmitter on site. We are going to be working to install a permanent antenna and feed line so we can broadcast a message. It will be a scripted message that we are using across all the other vaccination sites. We've had very good success with this message. It will be some of the do's, some of the don'ts. We're also putting this message up on billboards around so people can know as they drive by that they can go to myvaccinegeorgia.com to register, as well as when they're listening to the message, there'll be some other instructions as to when you're in line, some of the do's, some of the don'ts, once you're on site. And we're going to leave that antenna there based on some of the information I've heard this morning, trying to reach recreational other areas. We're going to leave. Okay. We're going to leave that antenna there for some future use. Hopefully, I know there's been doing some movie screens there at the Civic Center, so hopefully that'll be for y'all to use in the future. You're going to be coming in. There's only going to be one way in, and that's going to be off the Lumpkin Boulevard, 1 Lumpkin Boulevard. And you will need a QR code and or a phone number to once you get on site to make sure that you have an appointment. Do y'all have any questions?
Yes, just a second. Councilor Woodson.
Yes, I just had a question. I'm not sure if it pertains to y'all or the city manager, but I'm going to ask. You know, sometimes when we have events or where there's a traffic detour, we put these big signs out that has a message. Will we be able to have those like in nearby or in the community where people driving by can see where it says go to myvaccinationgeorgia.com and register for a shot, and it could tell who qualifies at this time. So that can also help get the information out to the community. I'm just thinking it's important if we did that, if we put it out through certain parts of the city, then people will get that information. Because unfortunately, with media and everything we do, there's still people that fall through the loop that don't know about it. But if you're driving and you see it, you know, it will remind you, hey, I want to go get a vaccination, let me go register.
You know, we have 3 variable message boards. They're mobile, and we'll certainly make sure we use those in this process, strategically locating them with a message that can be read, of course. It'll be succinct, short, to the point, so that people can see it as they drive by, but certainly.
Okay, thank you. Appreciate it. It's just to get the word out, you know, more out there. And I don't know if we need more, and maybe DOT will help us out, but we need to get the message out, because there's people that will call me and say, hey, I want to get a vaccine. Where do I go? Hey, you know, so it's very important that we get the word out and say, hey, it's here. Come on out.
Well,
you know.
and certainly we'll use CCG TV
Okay.
to communicate that as well.
Okay. All right. Thank you.
Ma'am, just so you know, also, we have an external affairs team within GEMA who will be downrange with us here in Columbus for the first week. They will be talking directly with your public affairs folks here in the city, also with Rob's public affairs folks. We've already setting up meetings for that to make sure that messaging gets out to the public. Any miscommunication that happens, we'll have people on site to handle that in conjunction with your people who are also here.
Can we somehow, Isaiah, I'm not sure, or FEMA somehow, can we get it to like the Minister Alliance or other organizations of ministers that they can in their paraput, they can announce it to their congregation that this is available to them? And thank you for GEMA and everyone. I'm just thinking, you know, as an ordinary citizen, how would I find out? And so that's why I'm making these suggestions, because I think if we can get the religious community and the school system involved too, to send little notes to the kids, we can get everybody done and taken care of. Thank you.
Just a couple other points real quick, if you will. We have been doing a lot with the media lately. In fact, I was on the podcast of WRBL yesterday with the mayor, and we did a couple of interviews the other day. So any way we can get the word out, we'll be glad to do that and present anytime that anyone is willing to listen to us. So we want to get the word out as much as we can. I mentioned earlier the sites that we were looking at. The mayor's been adamant about getting out in the community. We are looking at sites at Spencer High School, Carver High School. The second shot for the large clinic that we did at the Civic Center is already getting scheduled. Obviously, those are registration for the second shot, but it's being scheduled at Peachtree Mall. We're getting out. We'll be at Shirley Winston again for a large clinic. So we're not just solely relying on the GEMA site. We believe that is going to be the long-term answer, but we are also getting out in the communities as well. So anything we can do to get that word out, we will definitely explore that. Thank you.
Yeah, and we also have access through the city manager's office and through our 311 system, the automated information system that we can send out and we target neighborhoods. So if we have a pop-up clinic with some of the vaccines, and I want to make it clear, and I know Mr. Corbett will back me on this, DPH and the hospitals continue to try to get vaccine. So we're so grateful for Jason and the guys from GEMA being down here setting this up to do a mass effort. But we also understand that there are going to be some pockets where folks have transportation issues, so we're going to try to deal with those as well through that automated information system, and we are looking into the possibility of setting up a call center that will not only receive calls from people who may not be internet savvy or comfortable registering through a portal. We'll be able to have people there that just takes their information, enters it, tells them when to show up. So we're trying to think of every avenue we can come up with to make sure everybody in this community and the surrounding region in Georgia knows of the availability of the vaccine. Councilor Thomas?
Mr. Corbett, I have had a question about our neighbors across the river.
Yes, ma'am.
This is for Georgia residents only, is that correct?
This is being advertised as Georgia residents only. According to the sources from GEMA, they're not going to turn people away. The goal is to get shots in arms, but it is a Georgia program. So we are obviously we believe our neighbors in so many ways. Or they come to our town, they're shopping here. A lot of them are working here. The Region I stance was from the beginning, if they were working here, they could get a shot here. So that was going on pretty throughout the process anyway. So when you go to the myvaccinegeorgia.com, the first thing it asks you is what county of residence you're in, and it is only Georgia counties. So there is some limitation there, but so I'm trying to tread lightly on the answer to that, I guess, is from what I've been told from GEMA.
That's why I asked you and not stayed with my answer.
Yes, ma'am. From what I've been told with GEMA, they want shots in arms. They want as many people as they can to get vaccinated. Those people are in our community, just like we're in their community. So. And I say that because I live in Phoenix City, outside Phoenix City, so I'm kind of on both sides. So it is something that we do believe there will be the ability to help our neighbors through this process. Our announcement is, as the announcement's been from GEMA and the governor, this is a Georgia program through GEMA, and when you sign up, it leans you towards picking the county you live in Georgia. So I guess I hope I can have a better answer to that in the future. I don't know that I have the exact answer. I don't want to burn my relations with GEMA standing up here and announcing something I shouldn't be announcing or saying, come on over, and do it. But we do believe there will be an opportunity there to help our neighbors as well.
Good. Thank you.
Absolutely. Can I say one more thing, Mayor?
Yes.
Something I failed to mention a few minutes ago was our educators and our education system in Muskogee County School District. We have 2 closed pods, and that stands for point of distribution, set up with the Muskogee County School District. We are going to be helping them. They have really stepped up and really helping themselves a lot with Tracy and Dr. Lewis. But we have 2 that are scheduled that will be taking care of all of their staff and the educators and working with DPH and Chief Scarpa sending fire medics and folks and an ambulance to help vaccinate that as well. So we are very encouraged knowing we're going to get our school folks vaccinated within the next few weeks. So,
Councilor Woodson.
Yes, I just want to make sure I'm clear on your answer back. So I don't mean to be rude, but anyway, so the priority is Georgia.
Yes,
but
ma'am.
if someone came from Alabama, you would, from Phoenix City, you would do the vaccination, correct?
Yes, ma'am. That is my understanding, but I'm going to let Jason from GEMA answer that, so I don't step on any toes there, okay? I'm gonna let him.
And
Thank you.
before he does that is because I want to make sure we do this as a, partnership.
Sure.
And let's say when you go to Phoenix City, if someone at first was afraid, to take the shot and didn't, and then you offer it in Phoenix City, then the same benefit will be given to someone in Columbus, correct?
Yes, ma'am. I believe that is true.
Okay.
But again, I may need to check on that a little bit. I'm going to let Jason take a point on the question, the first question you had, just to
Okay.
make sure we answer it right.
All righty, thank you.
Yes, ma'am, and thank you for the question there. From an operational objective, my objective is to get shots in arms. That's my directive from my boss and from the governor. When we're given 1,100 shots a day with 20 nurses, it would cost me a lot more time to pull someone out of the line than it would to give them a much-needed vaccine. And my objective is to put vaccine in arms. And so I will make sure that every effort is done. If they have an appointment, if they have registered the way they are required to register, and they have an appointment with a QR code, they will get a vaccine.
My only concern, the reason why I say that, my only concern is if we're here to vaccinate Georgia and we get lots of people from Alabama, then the Georgians don't get it. That's my only concern, but I agree with you. If someone's in line, it's fine, but we want to make sure it's even, it doesn't go one way more than another, because when people hear vaccination, they're going to come, and we got to make sure that the people in Georgia did get theirs. And I'm not trying to be ugly, I'm just being honest, that we want to make sure that our residents have that opportunity to get vaccinated. And if that situation happened, then let it be vice versa the other way also, that if they go over there to Phoenix City, they can. I believe in the Tri-City community, always have, but right now with the vaccination and so many people, elderly, needing, and people with health issues, that concerns me, because a lot of the people that would come are elderly and have health issues, and I hate for them to be overruled by someone that's healthy or young just because they can come over the water. And I know a lot of my friends are from Phoenix City. They're probably going to call me and cuss me out, but it's how I feel. We're here to serve the people of Georgia, our taxpayers, and while I still want to be a neighbor, I want to ensure we're taken care of first, and then whoever else comes, more than happy.
Yes, ma'am, and it is a unique situation in
Yes.
Columbus, and I live in LaGrange, so I understand the same situation. Our website is myvaccinegeorgia.com, and there are counties that you would pick for residency once you're in there. Again, however, my goal at the end of the day is to get 1,100 shots and 1,100 arms, and that's what we will make sure happens here.
Okay. I want to just pluck a little something in there too, that we're doing all these little possible sites for the shots. We do have a lot of volunteers out in the community. I work with a group called Community Warriors. When Piedmont was giving their shots, they went in there and helped out. They did the paperwork, and it was a really great setup. I think his name is Terry, right? Mm-hmm. Terry set it up really fantastic. We as the Community Warriors went in, we did all the paperwork. They had the rooms lined up, the nurses there, and it was like clockwise. And it worked real good. So there are organizations out here that if you need assistance, we'll be more than happy to help. And I'm not committing them, but I'm just saying they're here. There are other organizations, other volunteers that would love to do the paperwork, verify the person's ID, make sure rewrite the paper when you got your shot, when you get your next one, and go get in line and get your shot.
Yes, ma'am, and within our agency, we have a division called VOAD, Volunteer Organizations Active in Disaster, and our VOAD lead, her name is Sarah Jackson, and we are vetting volunteer pharmacists, volunteer nurses, volunteer groups through them, so as we're not having to validate credentials on site. And so if anyone's interested in that, if they would just go to our VOAD, Volunteer Organizations Active in Disaster, on our webpage, at GEMA.gov, so you can check that out there.
Thank you.
All right, thank you. Councilor Tucker.
Yeah, I was trying to get that information that you said, the VOAB. Can you share it with?
Yes, ma'am. If you go to GEMA.ga.gov, which is our website, or just Google the Georgia Emergency Management Agency, there's a tab there for volunteers who would like to assist. We are hiring out our clinicians based, of course, we can't just have someone show up and say they're a pharmacist or a nurse, so we're vetting all of that through our state VOAD organization there. We have a volunteer here today. Tom Ollie is a communications volunteer who is working with us here in Columbus on site, and so we gladly accept volunteers. It just has to go through the state process of being vetted, especially for something as important as vaccinations.
Okay. Question, are we addressing the individuals who have already registered? I'm not sure if it was, is it 23,000 still left?
I think it's down to about 19, and there is no automatic port over of those individuals, but they are being encouraged to go back to myvaccinegeorgia.com and register as well.
Because I have a lot of senior citizens in my district that call, and I know some that I might not get because I haven't received those calls. Remember, I had told you this before, but how are we, getting to those individuals who have been on that waiting list for, the last few months, and some of them are close to like 80 years old, so.
Yes, ma'am. One of the first things that the mayor asked was when we found out what GEMA was coming to town was, can we merge the two lists? Mr. Bishop did as well. Can we merge the two lists into, the ones that have been waiting for public health into the GEMA site? There is no automatic merge, as the mayor mentioned, but I have reached out to public health, and they have agreed to send messaging to those people that have signed up for their list, directing them to go to the myvaccinegeorgia.com. That way, they can get on that list and hopefully get through a little quicker. Obviously, they're doing 1,100 up to 2,000 or 3,000 shots a day. We believe we can get more people through there quick. The last number, Mayor, I had 2 days ago was we were around 19,000 now. It's down a little bit that were on that list, and we're hoping to, some of those are probably going to be duplicates. Some of those are probably some that have already received the shot somewhere else. But we hope that list can be wiped out pretty quickly. As the PIO for the health department said, she said several weeks from now, we hope that list is non-existent. So, and again, we are still doing the smaller vaccination locations through the community to try to catch those that are already on that list.
Yep. Thank you, Chance. And the bottom line here is that this is a significant challenge. Not so much the administering the shots, but getting the information out and trying to create an orderly process for them to come through. That is why, frankly, we are so excited that GEMA is here. They have a template. They drop in. They look for a location. They found it in the Civic Center. And we know they're going to do their part and be putting a lot of vaccines in arms. We're going to continue doing our part in conjunction with DPH and with the hospitals, and we're going to be having some stand-up clinics, and we will view it as our challenge to come up with innovative ways to let folks in these neighborhoods know that it's available. So thank you.